Sitting in your high school class during a normal day, doing normal classwork and about to eat your normal lunch, when you get a text message from your dad saying, "Call me ASAP." You don't think much of the text, but decide to call him anyways, because you know your mother's in the hospital doing normal routine checkups that she does yearly. Your father informs you that you need to get to the hospital when you get out of school, so you can see your mother, who he and her want to talk to you and tell you something. Your mother has cancer, your father says, when you walk into the hospital room. You start to immediately think of how this could have happened because you thought the cancer before was gone and she was cured, but you can do nothing now but listen to the doctors. Routine checkups have saved my mother's life not once, twice, 3 times, but 4 times now. This was her 4th time having cancer, and this time it was back with a vengeance. The cancer didn't know that my whole family, especially my mother, had her fighting gloves ready and eventually would win the fight. Routine checkups have saved her life so many times before because they were able to detect the cancer before it grew into something serious. That is why it is important to do checkups regularly before anything else happens. According to Cancer Research United Kingdom, cancer that's diagnosed at an early stage before it's had a chance to get too big or spread is more likely to be treated successfully. If the cancer is spread, treatment becomes more difficult, and generally a person's chances of surviving are lower. Last year alone, 7.6 million people died from cancer around the world. That number would have been greatly reduced if people would do checkups regularly, as the doctors at American Cancer Society suggest. Early detection is available at any time from any of your primary healthcare representatives. For breast cancer, females should get checkups at the ages of 40 and older yearly by doing mammograms. CVEs, or clinical breast exams, should be done once every 3 years for women ages 20 to 30. These are only a few examples of what clinical exams have to offer to help with early detection. For more information, it can be found at www.cancer.org/healthy. Men are also not to be excluded from these exams because routine checkups for the more common than not prostate cancer are available as well. Now that we know more about checkups, we can look more into why we should do checkups and what are causes of cancer and how we can prevent them. There are many different types of cancer that can affect all types of races and genders. Preventing cancer starts now. The major causes of cancer are things that some people do daily, that are exposed to daily, that don't understand or don't even notice it. Genetic cancer is something you cannot prevent because it's part of your genes. My mother has 2 daughters who are my sisters who were fortunate enough to find out through testing that the cancer gene passed down through my family stopped at them. They did not have it. A second cause for cancer is tobacco use or exposure. Do not be fooled that secondhand smoke is okay and just a part of life, especially if you live on a ship like me 6 months more out of the year. Secondhand smoking, is a leading cause of cancer. Smoking, dipping cigars, or e-cigarettes with tobacco in them are deadly and can cause cancer. 450,000 deaths annually in the United States alone are the effects of tobacco-related cancer. You do not want to become a statistic. Even quitting now can give you more years to your life. On average, a non-smoker lives 10 years longer than one that does. Lack of exercise and diet are another leading cause of cancer. According to cancer organization called American Cancer Society, 589,430 Americans die from cancer each year. 1/3 of those cancer victims died because of poor diet, physical activity, or carrying too much weight. Becoming an active member in your community, volunteering, or even taking your dog out on a walk can bring down your chances of getting cancer. If one is unable to walk or move around because of arthritis or some other medical condition, you can find ways of moving other parts of your body that can become more active and will eventually have a better blood flow. A 4th cause of cancer is alcohol. Alcohol alone has been seen to cause 7 different types of cancer: mouth, throat, voice box, which is your larynx, esophagus, liver, colon, and even breast cancer. Ethanol, which is in each alcoholic drink, is what is known to cause cancer. So the rumors that certain drinks are more dangerous than others, do not be fooled, they are so false. That one drink, that one cigarette, or that one day you just want to stay in the house and don't want to go outside and do something, is that one thing that can make you wish you did. Because after cancer, you might not have the ability to do them if you wanted to. Cancer causes and preventions are clear. How you can raise chances of not getting cancer and what to make sure to do to not get cancer are easily known and found out through the different websites I told you. Now we need to come up with a solution to make sure people all around the world are knowledgeable. First, we need to enforce the laws that are in place to prevent children from using tobacco, not just smoking, but all types of tobacco. Make laws to enforce smoke-free zones for children on public grounds and places. Make it illegal for parents to smoke in a car with children, which is in progress. Children don't have the choice of getting a ride to school or being taken to soccer practice by someone that doesn't smoke if their parents are the one that smokes. Secondhand smoking is a leading cause of cancer. Secondly, make mandatory physical training for children in classes. Explain the importance of how it is imperative to keep one's body weight and diet intact and under control. Help someone who is in need of better diet or exercise routine. Ask your neighbor or friend to join you in a walk. Instead of taking the elevator to the second floor, why don't you just suggest to walk? According to Mayo Clinic, each person should get on average 30 minutes of exercise each day to stay healthy and prevent cancer. Thirdly, help someone who is in need of alcohol abuse. 1 in every 12 adults on average abuse alcohol. That means that at least one person in your class abuses alcohol and are further enhancing the risk of getting cancer. So look to your left, look to your right, and notice the signs of alcohol abuse and ask them if they would need help and lend out a helping hand. 4 out of 10 patients who get cancer this year are expected to be alive 5 years after diagnosis. This is a huge step from what cancer used to be, which was a death sentence. In the 1930s, the average was 1 in every 4 people. Routine checkups are important to anyone who is in the age bracket of being at risk. Risky behavioral people like drinkers, smokers, or bad dieters need to be more adamant about routine checkups. My hope is that in the next 70 years, 9 out of 10 patients will be expected to live 5 years after diagnosis. And it is all of our responsibilities to lend out a helping hand to others, and as well as to inform people about the risks of getting cancer, so they won't get the news like I got 5 years ago that changed my life. Thank you.